So hello friends, welcome to my new video. So this video is the continuation of keratitis, and today I will discuss about fungal keratitis. Okay, so let's start. So in the beginning I would like to say that fungal keratitis is also called as mycotic keratitis. Okay, so fungal keratitis are the most seen in the developing countries, and it is one of the most difficult form of keratitis that can be treated. Okay, so if we see about the types of fungus that are responsible for fungal keratitis, then there is two major types. Okay, one is yeast and another is filamentous fungi. Okay, yeast are yeast include candida and filamentous including the Fusarium and Aspergillus. So you can see these are the candida and this is the Fusarium and Aspergillus. Okay, so remember this thing that two type of fungi are mainly responsible for fungal keratitis: yeast and filamentous. Yeast include candida and filamentous. There is two types of filamentous fungi which are responsible for fungal keratitis, that is Fusarium and Aspergillus. Okay, so what are those predisposing factors for fungal keratitis? So what factors that can cause fungal keratitis? Suppose the person using steroid for a long period of time, then they have more risk of having fungal infection as their immune system get little weak. Okay, and another thing is that contact lens wearing can also lead to fungal infection. So if the person do not maintain the hygiene of the contact lens and also do not change the contact lens cleaning solution at right time, then they have more chance to get fungal infection. Okay, another risk factor is the person who have diabetes that is uncontrolled for a long period of time. Those persons are at highest risk of get infected by fungus and may also lead to fungal keratitis. Okay, and another thing is that trauma. Okay, if the person get any trauma to their eye with vegetative matter, then also they have risk of getting fungal infection. So here vegetative leading trauma means suppose the person have history of trauma with sugarcane leaf, then surely the person will have fungal keratitis. Okay, so if we tell about the clinical features of fungal keratitis, then in all fungal corneal infection, you will see feathery margin. So examine with slit lamp nicely and try to see what is there. Do not try to see what is not there. The things that you found in slit lamp examination, just note down. Another thing is that satellite lesion are also important sign of fungal keratitis. So find it also. And slit lamp examination, you should check what is abnormal there. Then only you can find the sign that will help you to understand the causative organism. Okay, and in fungal keratitis, you will see the pseudodendrites. So don't get confused with dendritic pattern with the HSV keratitis. Okay, the dendritic pattern that is present in HSV keratitis are very prominent and regular, but pseudodendrites are not that much prominent. Okay, they look like a dendritic pattern, but they are not look as prominent as HSV keratitis having dendritic pattern. Okay, so you can easily find that it is a pseudodendrites. Okay, another thing is that elevated epithelium, you will see elevated epithelium, so just use optic section, then you can easily understand. And in fungal keratitis, you will see hypopyon in the anterior chamber, but the hypopyon that are present in fungal keratitis are immobile. Okay, so if you see in this picture, then you can see these are the feathery margins that I was telling with you all. So by looking at this type of feathery margin, you can easily understand that it's a case of fungal keratitis. Okay, uh, another thing is that here you can see the satellite lesions. Okay, uh, these are satellite lesions. So you need to check this also, that along with feathery margin, you need to check this the presence of satellite lesion, because these satellite lesions are present in only fungal keratitis. Okay, so in this picture, so this is a infection with filamentous fungi, so which is usually associated with outdoor trauma. Okay, so particularly from vegetative matter. So this is a case of Aspergillus corneal ulcer. So there is a ring infiltrate that you can see. This is the ring infiltrate and the edges of the infiltrates with feathery margin appearance. Okay, and you can also see the dense congestion with edema in the eyelids. Okay, so if we go to this picture, then this is a dense stromal infiltrate with indistinct margin. So it is this is the stromal infiltrate, and you can see the margin is indistinct. So in bacterial keratitis, the margin is very much sharp, okay, and prominent, but in fungal keratitis, the margin is less prominent, okay, or indistinct, okay. Now if we go to the investigation, then what is the investigation that will be done? So here 10% KOH mount preparation for smear and culture with seborrheic media, okay, that is also done. To investigate or to this is done in the microbiology lab to find the what is the type of that causative organism. That by looking at the clinical sign you are now understanding that this can be a fungal infection, but for that surety or assurance purpose, you need to send the patient, or the doctor will send the patient to microbiology for investigation. So in here also you can see little bit elevation here. So these are the signs of fungal keratitis, okay. So if we see the management, then first of all, netamycin 5% eye drops 1 hourly, and it is effective against most common fungi, mainly Fusarium and Aspergillus, okay. And topical amphotericin B, it is the amphotericin B, it is 0.25%, and duration is 1 hourly. So it is effective against Aspergillus and Candida, okay. So another thing is that voriconazole eye drops, 1 to 2 hour daily, hourly, and it is more effective against Aspergillus, okay. So that's all friends, thanks for watching, and please don't forget to like my video, subscribe to my channel. I hope this video help you to understand the clinical features and also how to manage and how this fungal keratitis actually look like. So don't forget to like my video and subscribe to my channel.